Good evening from New York. I'm Chris Hayes. President Donald Trump is so concerned primarily, overwhelmingly, with how the coronavirus pandemic affects his day-to-day political fortunes, that even with hundreds of thousands of cases and tens of thousands of deaths in this country, he is still, to this date, overriding scientific experts to try to make it through each new news cycle. Today, we got the latest example of this extremely dangerous pattern, fixation of the president, constantly putting his own PR over science. This story broke yesterday. It didn't get a lot of attention. It's a strange story. And it was that the director of a government agency that plays a very big role in vaccine development suddenly left his post. Weird, kind of out of nowhere. I mean, why would this guy, Dr. Rick Bright, suddenly leave in the middle of the worst pandemic in a century to go to some other less important position in the government? Dr. Bright spent his entire career in vaccine development and was previously responsible for preparing the nation for influenza pandemics and coordinating production, acquisition, and delivery of medical countermeasures during a pandemic response. In fact, Congress just tripled his agency's budget to work on coronavirus projects. So he seems like someone you would want to keep around in his position. Well, we learned today, first reported by New York Times, that Dr. Bright says he was sidelined because he pushed back against the president's constant shilling for an untested malaria drug known as hydroxychloroquine as the magical cure for coronavirus. Dr. Bright released a lengthy statement through his attorneys today telling his side of the story. And in terms of statements, this is just explosive. It's a kind of worst case scenario. I want to read you a large part of what he says so you get a sense of what he is claiming happened. Quote, "I believe this transfer," meaning his transfer away from his position, "was in response to my insistence that the government invest the billions of dollars allocated by Congress to address the COVID-19 pandemic into safe and scientifically vetted solutions and not in drugs, vaccines, and other technologies that lack scientific merit. I'm speaking out because to combat this deadly virus, science, not politics or cronyism, has to lead the way." Dr. Bright says he also resisted efforts to, and I quote him here, "fund potentially dangerous drugs promoted by those with political connections. Specifically, and contrary to misguided directives, I limited the use of chloroquine and hydroxychloroquine promoted by the administration as a panacea, but which clearly lack scientific merit. While I am prepared to look at all options and to think outside the box for effective treatments, I rightly resisted efforts to provide an unproven drug on demand to the American public. I insisted that these drugs be provided only to hospitalized patients with confirmed COVID-19 while under the supervision of a physician. These drugs have potentially serious risks associated with them, including increased mortality observed in some recent studies in patients with COVID-19. Sidelining me in the middle of this pandemic and placing politics and cronyism ahead of science puts lives at risk and stunts national efforts to safely and effectively address this urgent public health crisis." My God, if that is true. The president was pushing day after day, along with his allies on Trump TV, pushing this unproven drug, which we don't know whether it works or not, whether it's safe or effective or not. It might be, it might not be. They were pushing it because they wanted people to think there was some magical cure around the corner. But Dr. Bright also seems to be implying in that statement there's some sort of profit motive for politically connected people promoting the drug. That's crazy. On the corruption scale from 1 to 10, that's an 11. This is happening in the middle of a pandemic when thousands of people are dying every day. This is just the latest example, the president putting his own very short-term political interests over the broad health and safety of the American people. Just yesterday, the president's director of the CDC warned of a second wave of the coronavirus later this year, when also flu season would make it a much harder to fight, a totally uncontroversial, scientifically grounded statement. But not for the president. In his nightly propaganda festival in the briefing room a short time ago, Trump prompted his CDC director to say he was misquoted about the possibility of the virus reflaring. And then standing next to the president, the CDC director confirmed under questioning he was not misquoted and basically reiterated his previous point. We're months into this pandemic and the behavior is not new. I mean, president has been doing this from the very beginning of the outbreak. 2 months ago, seems like another lifetime, Dr. Nancy Messonnier, another unknown public health expert, just like Dr. Bright, a serious career government official, works in the CDC, she warned us what was in our future.
Ultimately, we expect we will see community spread in this country. It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness. I understand this whole situation may seem overwhelming and that disruption to everyday life may be severe, but these are things that people need to start thinking about now. I had a conversation with my family over breakfast this morning, and I told my children that while I didn't think that they were at risk right now, we as a family need to be preparing for significant disruption of our lives.
Significant disruption of our lives. That was on February 25th, almost 2 months ago, another lifetime ago. And looking back, she absolutely nailed it. She knew exactly what was going to happen. She's a person in the government whose job is to do that. Well, today, the Wall Street Journal reports the president was so furious when he found out about her briefing, he wanted to get rid of her. Quote, a furious Mr. Trump, flying back to Washington from India, called Health and Human Services Secretary Alex Azar and threatened to oust Dr. Messonnier for the sin of correctly predicting the future. Now, President Trump could have listened to his own health expert and acted quickly, but he did not. According to the New York Times, if he had acted quickly, that could have saved tens of thousands of American lives. Yes, that's the number. An estimated 90% of the cumulative deaths in this country from COVID-19 might have been prevented by putting social distancing policies into effect 2 weeks earlier. 2 weeks. But no, instead, he didn't like the news cycle and the stock market, so Dr. Messonnier was benched. And literally the next day, the president said this about coronavirus cases in the U.S. We're going very substantially down, not up. Within a couple days, it is going to be down to close to zero. We're going to hit 1 million at some time in the next few weeks. Oh, also, I view this the same as the flu. And now here we are. 2 months later, we're heading towards 50,000 dead Americans. Remember, South Korea, they verified the first case of the coronavirus in their country on the very same day as us here in the United States. And South Korea has 238 total deaths. We also learned today the cost of this inaction was even greater than we initially realized. Reporting today, it appears the first death of coronavirus came on February 6th. That's about a month earlier than we previously realized. President Trump had a chance to stop this disease and to save tens of thousands of American lives, but because he only cares about how the disease impacts his personal image and cable news coverage from 1 minute to the next, and then his reelection, we are suffering through a medical and economic disaster that we are in the middle of.